Lymphoid progenitors are produced in which of the following tissues? A. The bone marrow. B. The liver. C. Gut-associated lymphoid tissue, GALT. D. All of these. The answer is D. All of these. Lymphoid progenitor cells are produced in all of the following tissues: the liver, the bone marrow, spleen, and gut-associated lymphoid tissue, mainly found in the liver and intestines. However, note that the vast majority of all blood cells are produced in the red bone marrow of long bones by hematopoietic stem cells. Which immune cell is specialized for immunity against multicellular parasites? A. Eosinophils. B. Basophils. C. Monocytes. D. Natural killer cells. The answer is A. Eosinophils. While all of the cells listed may have some indirect involvement in the overall response to a parasitic infection, eosinophils are the only immune cells that are specialized to respond to multicellular parasites, especially helminths such as hookworms and pinworms. Mast cells contain high concentrations of which of the following? A. Tryptase. B. Heparin. C. Histamine. D. All of these. The answer is D. All of these. Mast cells are rich in granules that contain high concentrations of heparin, histamine, and trypsin, among other preformed proteases. These granules also contain serotonin and various eicosanoids. The function of mast cells is primarily to regulate immune, inflammatory, responses to allergens. Which of the following would be considered to be part of nonspecific immunity? A. Plasma cells. B. Macrophages. C. Memory cells. D. CD8 T cells. The answer is B. Macrophages. Macrophages, the main blood cells responsible for phagocytosis of debris, bacteria, and virally infected cells, are part of the nonspecific immune response. While they are able to recognize self versus non-self proteins, they are not uniquely sensitive to any particular non-self protein type. Rather, they phagocytose foreign matter as well as cellular debris. Plasma cells, memory cells, and CD8 T cells are all lymphocytes, and as such they are all part of the adaptive or specific immune system, meaning that they are uniquely sensitive to particular pathogenic proteins. Which of the following antibacterial enzymes is present in saliva? A. Linguolipase. B. Lysozyme. C. Kallikrein. D. Amylase. The answer is B. Lysozyme. While all of the enzymes listed are present in saliva, lysozyme is the only enzyme listed that has antibacterial properties. This enzyme, present not only in saliva but also in tears, sweat, and breast milk, damages bacterial cell walls, making it an important part of the innate immune system. Amylase breaks down carbohydrates, lipase breaks down lipids, and kallikrein breaks down proteins. Which of the following cell counts is particularly diminished in patients with AIDS, and is used to measure disease extent? A. CD8 T cells. B. Platelets. C. CD4 T cells. D. Monocytes. E. Neutrophils. The answer is C. CD4 T cells. In AIDS, which is the most progressed stage of HIV, the cell type that is most significantly diminished is CD4 T cells. Oftentimes, the degree of disease progress of HIV and AIDS is established by monitoring the patient's CD4 T cell count across the course of the illness. The CD4 count guides differential diagnosis when patients with HIV or AIDS present with various complaints, and also guides what prophylactic measures, for example antibiotics, antifungals, are administered to these patients. While CD8 T cell, monocyte, platelet, and neutrophil counts may each be decreased for various reasons in patients with HIV and AIDS, the most substantial association between diminished cell count and HIV/AIDS is that of CD4 T cells. How many lobes total are there in the human lungs? A. 3. B. 5. C. 4. D. 6. The answer is B. 5. There are 5 lobes total in the human lungs. The right lung has 3 lobes, the upper lobe, the middle lobe, and the lower lobe, while the left lung has 2 lobes, the upper lobe and the lower lobe. What is the name for the topmost part of the lung? A. The apex. B. The hilum. C. The lingula. D. The trachea. The answer is A. The apex. The topmost part of the lungs is the apex. This area extends into the neck above the first rib and is the location auscultated for a diagnosis of a Pancoast tumor. The lingula of the lung is a small flap of the lowest part of the upper lobe of the left lung. The hilum is the entry point of the lung for the bronchi, pulmonary artery and vein, and nerves. The trachea is not a part of the lung at all. It is the cartilaginous tube that connects the pharynx and larynx to the lung. Which of the following lists of airway structures is in order from largest to smallest? A. Trachea, bronchiole, bronchi, alveoli. B. Trachea, alveoli, bronchiole, bronchi. C. Trachea, bronchi, bronchiole, alveoli. D. Bronchi, trachea, bronchiole, alveoli. The answer is C. Trachea, bronchi, bronchiole, alveoli. The largest airway structure is the trachea. This branches into 2 smaller bronchi, which enter the left and right lung and bifurcate further into smaller bronchioles. The bronchioles give way into the smallest structures of the lung, the tiny grape-like clusters of alveoli.
What structure of the lung is primarily responsible for controlling volume of airflow during respiration? A. The alveoli. B. The bronchioles. C. The trachea. D. The bronchi. The answer is B. The bronchioles. The main mediator of airflow during respiration is the bronchiole. These tiny airways are wrapped in smooth muscle, which allows them to contract or relax in order to restrict or increase airflow in the lung. The trachea and bronchioles are cartilaginous rather than muscular, and are unable to constrict, while the wall of the alveolar sac is also devoid of smooth muscle, made up only of epithelial cells, capillaries, and connective tissue.
Which of the following allows debris to be removed from the lung? A. The mucociliary escalator. B. The pleural lymph system. C. Bronchiolar constriction and dilation. D. Granulation. The answer is A. The mucociliary escalator. The system by which debris is removed from the lung is termed the mucociliary escalator. This is made up of two parts, the mucus produced by respiratory goblet cells, and the wave-like movement of cilia covering the bronchioles and bronchi of the lung. Bacteria and particles of debris are caught in the mucus coating the cilia, which is then passed in waves upward toward the trachea. Once it clears the trachea and enters the pharynx, it can either be coughed out or swallowed. The major alveolar cell type, making up 95% of alveolar cells, is type I. Only 5% of alveolar cells are type II, yet they serve a vital function in respiratory physiology. What is the function of type II alveolar cells? A. They are the site of gas exchange. B. They secrete surfactant. C. They nourish the type I cells. D. They are important for the integrity of the alveolar connective tissue. The answer is B. They secrete surfactant. Type II alveolar cells secrete pulmonary surfactant, a lipoprotein complex that is essential for lung function. This surfactant acts to break up the surface tension of fluid coating the lung air spaces, allowing for alveolar compliance and reducing the buildup of fluid in the lung. Lack of surfactant can lead to atelectasis, or collapse of part of the lung. Which of the following is the primary muscle of respiration? A. The intercostals. B. The scalens. C. The sternocleidomastoid. D. The diaphragm. The answer is D. The diaphragm. The most important muscle of respiration is the diaphragm, followed by the intercostals. The sternocleidomastoid and scalens are considered accessory muscles of respiration. How do bronchioles respond to an increase in the partial pressure of carbon dioxide in the alveoli? A. They secrete mucus. B. They constrict. C. They dilate. D. The bronchioles do not respond to changes in the partial pressure of carbon dioxide. The answer is C. They dilate. Carbon dioxide has paracrine effects in the airway, causing the smooth muscle of bronchioles to relax. When the partial pressure of carbon dioxide in the alveoli increases, the bronchioles dilate. This allows for increased ventilation. What nerve innervates the diaphragm, necessary for normal inhalation? A. The intercostal nerve. B. The phrenic nerve. C. The subcostal artery. D. The vagus nerve. The answer is B. The phrenic nerve. The diaphragm is innervated by the phrenic nerve. This nerve exits the spine at C3, C5. In the case of spinal cord trauma, if injury occurs above C3, the diaphragm is no longer able to function on its own and breathing assistance is generally required. Which of the following terms describes the maximum volume of air a person can exhale after maximum inhalation? A. Functional residual capacity. B. Residual volume. C. Vital capacity. D. None of these. The answer is C. Vital capacity. Vital capacity is the maximum volume of air a person can exhale after maximum inhalation. Residual volume is the air that remains in the lung after forced exhalation, while functional residual capacity is the volume of air that remains in the lung after a relaxed exhalation. In the average adult, how much air remains in the dead space of the lung after normal expiration? A. 250 milliliters. B. 750 milliliters. C. 150 milliliters. D. 70 milliliters. The answer is C. 150 milliliters. Dead space is the volume of air that remains in the trachea, bronchi, and bronchioles during respiration. It does not enter the alveoli and so does not participate in gas exchange. In the average adult, the amount of air left in the dead space after expiration is 150 milliliters. What is the average volume of air breathed into and out of the respiratory system during tidal breathing? A. 1,200 milliliters. B. 1,000 milliliters. C. 500 milliliters. D. 750 milliliters. The answer is C. 500 milliliters. Tidal breathing is the term for relaxed inhalation and exhalation, as opposed to maximum inspiration and forced exhalation. The average volume of air breathed into and out of the respiratory system during tidal breathing is 500 milliliters. Which of the following would cause bronchoconstriction? A. Cold air. B. Allergens. C. Parasympathetic input. D. All of these cause bronchoconstriction. The answer is D. All of these cause bronchoconstriction. There are many factors that can cause bronchoconstriction. Some of them are normal physiological responses, such as parasympathetic input or decreased partial pressure of carbon dioxide in the alveoli. Other causes are pathological, such as allergic bronchoconstriction or asthma triggered by cold air. What are the two types of alveolar cells? A. Interstitial cells and active cells. B. A cells and B cells. C. Type 1 and Type 2. D. Primary and secondary cells. The answer is C. Type 1 and Type 2. There are two types of alveolar cells, Type 1 cells and Type 2 cells. Each cell type has a unique function within the alveolus, and the dysfunction of either cell type results in serious respiratory pathology. Type 1 cells are simple squamous epithelial cells that account for about 95% of all alveolar cells. They are the primary cells responsible for diffusion of gases across the respiratory membranes. Type 1 alveolar cells are responsible for secreting surfactant, which facilitates the diffusion of substances across the epithelium. When the diaphragm contracts, lung volume dash. A. Increases. B. Diffuses. C. Decreases. D. Compresses. The answer is A. Increases. The diaphragm is a thin sheet of muscle that separates the thoracic cavity from the abdominal cavity. At rest, it is drawn upward into a dome-like shape under the lungs. When the diaphragm contracts, the dome flattens out, which increases the size of the thoracic cavity. The negative pressure allows the lungs to expand and fill with air, causing an increase in total lung volume, inhalation. What chamber of the upper respiratory tract is shared by both the respiratory and digestive systems? A. The pharynx. B. The soft palate. C. The esophagus. D. The sinuses. The answer is A. The pharynx. The only chamber of the upper respiratory tract that is shared by both the respiratory and the digestive systems is the pharynx. The pharynx is the part of the throat that is immediately posterior to the mouth and the nasal cavity, and superior to the trachea, larynx, and esophagus. Which of the following is not a division of the pharynx? A. The sonopharynx. B. The oropharynx. C. The nasopharynx. D. The laryngopharynx. The answer is A. The sonopharynx. The pharynx is made up of three divisions: the laryngopharynx, the oropharynx, and the nasopharynx. There is no portion of the pharynx called the sonopharynx. Which of the following pairs of sinus is absent at birth, and is not fully developed until puberty? A. The ethmoid sinus. B. The frontal sinus. C. The sphenoid sinus. D. The maxillary sinus. The answer is B. The frontal sinus. The frontal sinuses are not present at birth. They begin to develop in the first few years of life, but they are not fully mature until after adolescence. The sphenoid, maxillary, and ethmoid sinuses are present at birth, though they are underdeveloped and similarly do not mature fully till late childhood or adolescence. Which of the following is a flap of cartilage that covers the opening of the windpipe during swallowing to prevent aspiration? A. The cricoid cartilage. B. The hyoid. C. The tracheal cartilage. D. The epiglottis. The answer is D. The epiglottis. The small flap of cartilage that covers the windpipe to prevent aspiration during swallowing is the epiglottis. It is located at the base of the tongue and attached to the entrance of the larynx. Which of the following maintains the lumen of the trachea? A. Air pressure within the respiratory tract. B. The tracheal cartilages. C. The infrahyoid muscles. D. The cervical spine. The answer is B. The tracheal cartilages. The lumen of the trachea is maintained by the tracheal cartilages, a set of approximately 20 separate C-shaped rings of hyaline cartilage. The non-continuous cartilage allows for greater flexibility during inspiration and expiration. Which of the following best describes the epithelium of the trachea? A. Pseudostratified columnar cells with cilia and goblet cells. B. Stratified squamous epithelium with cilia and goblet cells. C. Cuboidal epithelium with cilia and goblet cells. D. Transitional cells with cilia and goblet cells. The answer is A. Pseudostratified columnar cells with cilia and goblet cells. The epithelium of the trachea is made up of pseudostratified columnar cells with cilia and goblet cells. What structure is directly posterior to the trachea? A. The pharynx. B. The thyroid gland. C. The esophagus. D. The cervical spine. The answer is C. The esophagus. The esophagus is directly posterior to the trachea, and the cervical spine is posterior to the esophagus. The thyroid gland is anterior to the trachea. The pharynx is superior to both the trachea and the esophagus. What does the trachea bifurcate into? A. Left and right primary bronchioles. B. Left and right secondary bronchioles. C. Left and right secondary bronchi. D. Left and right primary bronchi. The answer is D. Left and right primary bronchi. The trachea bifurcates into the left and right primary bronchi. This occurs at a location called the carina, which is at the level of T4-T5. A nurse is about to perform an upper respiratory exam on a patient with sinusitis. Which of the following sinuses are inaccessible for assessment by physical exam due to their placement deep within the skull? A. The maxillary and frontal sinuses. B. The maxillary and sphenoid sinuses. C. The ethmoid and sphenoid sinuses. D. The frontal and ethmoid sinuses. The answer is C. The ethmoid and sphenoid sinuses. The only sinuses that can be assessed on physical exam are the frontal and maxillary sinuses. The sphenoid and ethmoid sinuses are too deep in the skull to be assessed via physical examination. Which of the following structures is the site of gas exchange in the lung? A. The bronchiole. B. The bronchus. C. The alveolus. D. The pleura. The answer is C. The alveolus. Gas exchange in the lung occurs exclusively in the alveoli, the tiny grape-like clusters of sacs at the terminus of the bronchioles of the lung. The gas contained in the larger structures of the lung, the trachea, bronchi, and bronchioles, is termed dead space as it does not participate in gas exchange. Which of the following is the main trigger for the impulse to breathe? A. Low blood oxygen. B. Constriction of the bronchioles. C. High blood carbon dioxide. D. Dilation of the bronchioles. The answer is C. High blood carbon dioxide. The main trigger for the impulse to breathe is high carbon dioxide, decreased blood pH. In response to a decrease in blood pH, the medullary respiratory center triggers the diaphragm and the external intercostal muscles to increase breathing rate. Myoglobin combined with dash molecules of oxygen, while hemoglobin combined with dash molecules of oxygen. A. 3. 4. B. 1. 2. C. 2. 4. D. 1. 4. The answer is D. 1. 4. Myoglobin, an oxygen-binding protein in the muscle tissue, combined with one molecule of oxygen. Hemoglobin, the main oxygen-binding metalloprotein in red blood cells, combined 4 molecules of oxygen. Hyperventilation results in which of the following? A. Ketoacidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Respiratory acidosis. The answer is B. Respiratory alkalosis. While hyperventilation or tachypnea may be triggered by various forms of acidosis, they will not cause a decrease in blood pH, but rather push the blood into a more alkaline state. This occurs due to loss of carbon dioxide during respiration, followed by a compensatory decrease in bicarbonate ions. The result is in an elevation in the pH of the blood. This condition is known as respiratory alkalosis. What does the term partial pressure describe? A. The pressure contributed by a single gas in a gas mixture. B. The pressure of an overall gas mixture during transition, adding a new gas. C. The pressure of a gas at 1000 meter above sea level. D. The difference between the gas pressure at a particular altitude and sea level. The answer is A. The pressure contributed by a single gas in a gas mixture. Many gases, such as room air, are composed of several gases, in the case of room air, primarily nitrogen, oxygen, and several trace gases. Partial pressure is the amount of pressure that each gas contributes. To find the total pressure of a gas mixture, one would find the sum of all partial pressures of each individual gas. How do oxygen and carbon dioxide cross the capillary epithelium and alveolar cell membranes during gas exchange? A. O2 transporter. B. Osmotic exchange. C. Simple diffusion. D. CO2/O2 pump. The answer is C. Simple diffusion. Gas exchange in the alveoli occurs by the process of simple diffusion. The blood that enters the lung capillaries is relatively low in oxygen and high in CO2, in comparison to the room air that is drawn into the alveoli during respiration. The separation between the capillaries and the alveolar epithelium is thin enough that these gases can exchange across their pressure gradients by the process of simple diffusion. Increased epinephrine would have what effect on stroke volume? A. Stroke volume would stay the same. B. It would cause irregularities in stroke volume. C. Stroke volume would decrease. D. Stroke volume would increase. The answer is D. Stroke volume would increase. Increased epinephrine, released either by the adrenal medulla or by myocardial innervation, increases contractility in the heart, which in turn increases stroke volume. Which of the following valves must blood pass through to go from the right atrium into the right ventricle? A. The tricuspid valve. B. The semilunar valve. C. The foramen oval. D. The mitral valve. The answer is A. The tricuspid valve. Blood in the right atrium must pass through the tricuspid valve to enter the right ventricle. The mitral valve is between the left atrium and the left ventricle. The semilunar valves are located at the base of the aorta and the pulmonary trunk, also known as the aortic valve and pulmonary valve. The foramen oval is a type of shunt that exists in the fetal heart. Its presence in an adult patient is a form of congenital heart defect. The S2 heart sound, dub, is heard during what part of the cardiac cycle? A. Diastole, during the closing of the aortic and pulmonary valves. B. Systole, during the closing of the aortic and pulmonary valves. C. Diastole, during the closing of the tricuspid and mitral valves. D. Systole, during the closing of the tricuspid and mitral valves. The answer is A. Diastole, during the closing of the aortic and pulmonary valves. The S2 heart sound, sometimes referred to as the dub in lob dub, occurs in diastole, during the closing of the aortic and pulmonary valves. When pressure within the aorta and pulmonary arteries exceeds pressure within the heart, the cups of the valves fill with blood and snap shut, causing the dub sound. Depolarization is able to travel in a uniform wave through myocardium due to what physiological feature? A. Gap junctions. B. T-tubules. C. Striation. D. Desmosums. The answer is A. Gap junctions. Depolarization is able to travel in a uniform wave through myocardium due to the presence of gap junctions. These junctions allow the depolarizing current to be transmitted directly from cell to cell in the heart. Striation in cardiac muscle is a feature of contraction, created by overlapping thick and thin contractile filaments. Desmosums are strong fiber-like anchors between myocardial cells and T-tubules, while an important part of depolarization, are not responsible for the rapid intercellular communication that occurs as a result of the presence of gap junctions. Parasympathetic innervation of the heart is primarily controlled by what nerve? A. The cardiac nerve. B. None of these is correct. C. The vagus nerve, CN10. D. The recurrent laryngeal nerve. The answer is C. The vagus nerve, CN10. The vagus nerve provides the main parasympathetic innervation of the heart. The recurrent laryngeal nerve, a branch of the vagus nerve, innervates the majority of the intrinsic muscles of the larynx. The cardiac nerve is part of the sympathetic innervation of the heart. What coronary artery supplies left atrium and left ventricle? A. The left coronary artery. B. The septal branches. C. The left circumflex artery. D. The posterior descending artery. The answer is A. The left coronary artery. The majority of blood supply to the left atrium and left ventricle is provided by the left coronary artery. The septal branches and left circumflex artery are smaller divisions of this main artery. The posterior descending artery supplies the posterior 1/3 of the interventricular septum. A nurse is performing an abdominal exam and notices a strong pulse in the abdomen just above the umbilicus. She is most likely palpating what blood vessel? A. The femoral artery. B. The exterior iliac artery. C. The inferior mesenteric artery. D. The abdominal aorta. The answer is D. The abdominal aorta. The nurse is most likely palpating the abdominal aorta. This vessel is large, generally 2.5 to 4 centimeters in diameter, and a strong pulse can often be felt on palpation. The femoral artery is also an area where a pulse may be felt, but it is only palpable in the mid-inguinal point of the inner thigh. The exterior iliac artery branches off of the abdominal aorta below the umbilicus, and the inferior mesenteric artery is a minor artery and is not generally palpable on examination. What is the formula for finding cardiac output, CO? A. Cardiac output equals stroke volume divided by heart rate. B. Cardiac output equals stroke volume multiplied by heart rate. C. Cardiac output equals ejection fraction multiplied by heart rate. D. Cardiac output equals ejection fraction divided by heart rate. The answer is B. Cardiac output equals stroke volume times heart rate. Cardiac output is the measure of the amount of blood that is able to circulate through the heart in 1 minute. It is found by multiplying the stroke volume times the heart rate, in beats per minute. The ejection fraction, another important measure of cardiac function, is not considered when calculating cardiac output. Oxygen-poor blood flows from the dash to the dash. A. Vena cava. Left atrium. B. Pulmonary arteries. Right atrium. C. Vena cava. Right atrium. D. Pulmonary veins. Left atrium. The answer is C. Vena cava. Right atrium. Deoxygenated blood from the body flows through the superior and inferior vena cava into the right atrium of the heart. From there it enters the right ventricle, then is ejected into the lungs via the pulmonary arteries. The blood is oxygenated in the lungs, then flows through the pulmonary veins into the left atrium, then into the left ventricle to be pumped back out into the body. How does parasympathetic innervation affect the heart? A. Increases heart rate and decreases cardiac output. B. Slows heart rate and increases cardiac output. C. Slows heart rate and decreases cardiac output. D. Increases heart rate and increases cardiac output. The answer is C. Slows heart rate and decreases cardiac output. Sympathetic innervation will decrease the heart rate, which will automatically decrease the cardiac output equals stroke volume multiplied by heart rate. Which of the following causes the S1 heart sound, lub? A. The opening of the aortic and pulmonary valves. B. The closing of the tricuspid and mitral, atrioventricular, valves. C. The closing of the aortic and pulmonary valves. D. The opening of the tricuspid and mitral, atrioventricular, valves. The answer is B. The closing of the tricuspid and mitral, atrioventricular, valves. The S1 heart sound, sometimes referred to as lub, is caused by the sudden snapping shut of the tricuspid and mitral valves during systole, when the heart contracts and tension on the chordae tendineae is released. No sound is produced on the opening of these or any other valves in the heart. The contraction rate is set in what area of the heart? A. The bundle of His. B. The atrioventricular node. C. The synovial node. D. The Purkinje fibers. The answer is C. The sinoatrial node. The contraction rate for the heart is set by the cells of the sinoatrial node, also known as the pacemaker cells of the heart. These cells have membranes that are especially permeable to ions, and are able to depolarize on their own at a rate of 70 to 100 beats per minute. All the other areas listed do have their own spontaneous contractility, but their rates are slower than that of the sinoatrial node. Thus, the sinoatrial node is the pacemaker in a healthy heart. Which of the following is the proper unit of measurement for blood pressure? A. Millimeter of mercury. B. Gram per deciliter. C. IU. D. Deciliter per millimeter. The answer is A. Millimeter of mercury. The proper unit when recording a patient's blood pressure is millimeter of mercury, or millimeter of mercury. This is derived from a historical measurement of how many millimeters of mercury in a mercury manometer were able to be elevated by a particular pressure. Due to its toxicity, mercury is no longer used in medical equipment, though the millimeter of mercury unit remains in use. A patient has a 49-year history of hypertension. Which part of the heart would be most enlarged on echocardiogram? A. Right atrium. B. Left atrium. C. Left ventricle. D. Right ventricle. E. Pulmonary artery. The answer is C. Left ventricle. The left ventricle is the most commonly enlarged heart structure seen in chronic hypertension. The left ventricle must overcome the afterload of the arterial system by becoming hypertrophied. As a result, the heart gets remodeled to overcome the systemic high blood pressures. The left ventricle directly pumps blood from the heart to the systemic circuit.